Well, also
system,
you got full coverage, which
I don't know.
One of the inherent problems with full coverage, and this is the problem with it, even like France doesn't even do full coverage, okay, and they're a socialist healthcare. But the reason they don't do complete full coverage, they do a partial copay, so that people make decisions based on actual pricing, so that the system doesn't go bankrupt. France still has bankruptcy problems with its health insurance. They usually have to allocate new monies every year. But the problem with full coverage,
There's Jason.
I told you.
no
Of course he
copay,
shows up. He always shows up. Yeah.
is every single time somebody goes to the doctor, they get the most expensive thing, regardless of whether they actually need that most expensive thing or not, which then runs the price up higher.
Yeah.
It's regardless of what the person is doing, it automatically runs the price up higher and higher every year.
We ordered
So
food.
it's very
You got 10 minutes for happy hour.
damaging to the bottom line.
Oh,
Is it 6 o'clock?
Yeah. No, I understand the problems, but I think the problems are more, countrywide institutional problems. You know how
Oh
I
yeah,
feel
there's
about
definitely
that.
more problems, but I'm just saying that with that particular thing that it kept getting under attack for. But that, no, I totally agree. I think everybody should have at least a small copay, even if it's so insignificant that all you do is go wait. One's $5 and one's $20.
Yeah,
Why
you
do
do
I
have a
have
copay when you go to. It's not. They pay the.
Well, some of the stuff theoretically isn't though. Like I guess full timers don't.
They don't pay
even
anything.
copay.
They don't.
They don't
no,
pay a
they
premium.
do. They don't pay a premium charge like I do. I
Out of
pay
the
a premium.
paycheck?
I pay
I see
out of the
what
check
you're
a deduction. I mean, there is a copay of something.
Like
$5,
$5.
$5,
Yeah,
it's
$10.
cheap.
Something's cheap.
The Oregonian article says it's cheap.
Yeah.
Well, it is
even
cheap,
the-
and it should be that way.
The nice thing about a copay is even if you do it cheap, which I think copay should be cheap too, but like if one medicine actually costs $50 a bottle, say, and one is $800 a bottle, and the copay is $5 for one and then $20 for the other, it at least makes you think, do I really need the $20?
The coverage, by the way, makes us take the generics if it's available.
Oh, okay.
Yeah,
and
so
that's,
they don't
that's
just give
actually
you that.
a fairly good plan. I mean, unless there's an absolutely good reason for someone to have
that, you're right.
some name brand shit.
Yeah.
Well, you gotta support the drug companies. You know,
Well, that's what it's really all about.
You know, in other countries, they sell the same name brand stuff at whatever the pricing is because they can still make money off it. They sell it higher in the U.S. for other various reasons that they come up with.
What do you mean higher? You can get drugs at 1/10 the cost outside the country.
Well,
here.
no, that's what I mean. It's the same companies that are selling those drugs.
It's the same
Well, some of the money though is for research and development.
Well, that's what they say.
Well, that's what I was going to say.
Profits,
For whatever argument you can make, and I'm still a firm believer that we nationalize the stuff. We're going to see a lot of research and development just dry up and go away because the U.S. funds half the damn stuff on the.
But they only research stuff that they can make money on. I was just reading an article about that. They don't research anything for like the African plagues, whatever, because there's no money to be made on that.
That's not in the U.S.
Well, I know, but I mean, there's potential customers everywhere. I mean, if there was money in Europe to find the cure for some kind of European,
if a company could safely put something like that to a market in one of those areas, they would. The problem is it's totally destabilized. I mean, you try to put something to market, they'll steal it from you and then they'll kill you.
Well, that's if you're walking around down there.
Right, exactly. So you like have to fly over and airdrop the shit.
I don't know. They can work with the corrupt governments. I mean, one of the reasons why those countries are so fucked up is because